All right, welcome everybody. And so let's talk about products with high THC concentration. These products have become one of the main areas of debate amongst those with opinions about the public health impacts of cannabis. So it's crucial we dive into that a little bit. Just doing a quick Google search, for example, just brings up article after article warning about the dangers of these products, some of which I've copied here. So that brings up the question, do these products present real concerns? Or is this just the modern day equivalent of reefer madness by those who just wish to consume or continue the demonization of cannabis that really began 100 years ago that we've talked about? Now, like most things, I suspect the answer is somewhere in the middle. So I think it's a key area that we need to explore so we can really appropriately educate consumers and the general public on this topic. First, we need to make some clear definitions. So, high potency THC products is the phrase that's most commonly used in the media and even amongst academic circles and in articles. However, the term potency is inaccurate. Potency is a way you compare two different compounds and how those two different compounds interact with the body. For example, Aleve and Advil are two common over-the-counter prescription medications, and they act very, very similarly in the body. They're the same type of medication, but they're two different medicines. Aleve is more potent than Advil. What that means is 200 milligrams of Aleve will have a stronger effect in the body than 200 milligrams of Advil. That's what we mean by potency. One compound reacting stronger or less strong in the body than another compound. The stronger compound is more potent. However, when we're talking about cannabis, we're generally always talking about THC as the primary ingredient. Thus, potency is always the same, regardless of the product, because potency compares two different compounds. We're really talking about one compound, THC. So when we're comparing different products, what we're comparing and what we're really talking about are the concentrations of THC in a product. Concentration is the amount of a single compound in a product, and that can vary significantly. Now, this should be a familiar concept to us if you think about, say, alcohol, for example. Different types of alcohol have different types of concentrations. On average, beer is about 5% alcohol. Wine is about 12% alcohol. Distilled spirits, about 40% alcohol. From a cannabis perspective, a specific Kimavara flower might have 15% THC. A brand of hash might have 50% THC. A distillate pen might have 90% THC or more. So just to be clear, THC concentration is the appropriate term to describe pot products, not potency. Now, unfortunately, once certain terminology becomes common, it's hard to correct. So you'll continue to hear the term high potency, but I recommend not using it yourself. Use the term high concentration and know that's what people really mean when they say high potency. Additionally, when it comes to cannabis products, what do we even mean when we say high concentration? There's a lot of different opinions. For example, a recent study done by the Colorado School of Public Health used anything over 10% as high concentration in their research. Now, that seems pretty low to me. It's nearly impossible to find cannabis products lower than 10% THC concentration in Colorado. Some might consider high concentration above 40%, which is typically you can only get that concentration when you're looking at vape pens or loose concentrates. So there's no real definitive answer of what high concentration means. And thus, if you're reading an article or looking at a study, you need to see what criteria they're using when they say high concentration. So moving on, what is dose then? And then how does dose relate to this? Dose is the specific amount of a compound that one consumes in a single session. To know what dose one consumes, you need to know the concentration of the product and how much of the product they consume. So let's go through a few examples because, as we'll discuss later, the dose of THC is really what matters, not necessarily the concentration. So let's start with a non-cannabis example and go back to our over-the-counter pain medication. Ibuprofen is a very common over-the-counter pain medication. Ibuprofen and Advil are the same thing. When you buy ibuprofen over the counter, its concentration is 200 milligrams per tablet. However, the dose one consumes is going to totally depend on how many tablets they take. And you could see that on the slide. Now, this same compound, ibuprofen, is also available by prescription. Prescription ibuprofen has a concentration of 800 milligrams per tablet, 4 times what over-the-counter does. So you might consider the prescription version high concentration ibuprofen. But again, the dose one consumes of this high concentration product can vary depending on how many tablets they take. So, for example, the maximum recommended dose of ibuprofen at any one time is 800 milligrams. But you can achieve this by taking 4 over-the-counter tablets or just 1 prescription tablet. And either way you do that, you're going to get the exact same dose in both situations, 800 milligrams. You're going to have the exact same potential benefits or risks, despite using products that have totally different concentrations. The higher concentration product isn't more harmful if you take an appropriate amount, and it's not necessarily better or worse. For example, it's easier to take 1 pill instead of 4. It's also commonly cheaper to use prescription ibuprofen if you're taking the maximum dose of 800 milligrams every time. But the higher concentration product also has some downsides. For example, maybe all you need for pain relief is 200 milligrams. If you're only using the high concentration product, you'll never know that the lower dose would have been effective in the first place, and then you're chronically consuming more than your body needed. Additionally, the higher concentration product can be very dangerous if you take the wrong number of pills. If you make a mistake and take 4 prescription pills, your total dose of 3,200 milligrams could be really dangerous and harm your stomach, your kidneys, or your liver. So the take-home points are that with these higher concentration products, it's more difficult to consume a lower dose, and it's easier to consume a potentially harmful amount. So now let's look at a couple different cannabis examples. First, let's just take 2 chemovars of flower, one having 10% THC concentration and the other having 20% THC concentration. You can see the total dose consumed is going to vary based on how much someone smokes or vapes of these flower types. If someone smokes a whole 1 gram joint of the low concentration product, the 10% flower, they'll get more THC or a bigger dose than someone who uses the higher concentration product, the 20% product, but they just use a smaller 1/4 gram amount. If you were to just take 1 puff of some real concentrated 30% flower, you'll still likely have less exposure, less total dose than if you smoked a whole joint of 10% flower. So as you can see, using a higher concentration product doesn't automatically mean you're consuming more THC. However, it makes it easier to consume more THC. Now let's move on to concentrates, since that's often what we're talking about when we hear about all these potential risks and concerns with high concentration products. You can see, even if someone's consuming a rosin, say, that's 80% THC, real high concentration, if they restrict themselves to a single tiny dab, they'll actually consume less THC than when smoking or vaping that low concentration 10% flower in pretty common amounts. But as they consume more with the dabs or the high concentration product, their total THC exposure dose starts going up real quickly. And we could take this one step further. Instead of using tiny dabs, say this individual is having larger dabs and then consuming several of those at a time, we could see now their total dose escalates quite dramatically, and you're able to get much higher amounts than if someone's consuming a lower concentration product. So similar to our ibuprofen example, when you have the higher concentration product, it's easier to consume these larger amounts and get a total dose. Now, I really want to spend some time on this because it's important in how we interpret the data. And even more importantly, it's crucial when we talk about harm reduction and providing good education to consumers. Now, here's one real interesting note about serving size and how education and policy plays a role. As many of you might know, starting a couple of years ago, Colorado requires dispensaries to give out anybody purchasing concentrates a handout that has educational and safety information. And in that handout, they include a maximum concentrate serving size, which I've shown here. This is a snapshot from the handout everybody gets. Now I checked, and the approximate weight of a dab that's this size is actually quite high, averaging about 100 to 300 milligrams, depending on the type of concentrate. And this gives a great example of how we might better design our educational materials if our goal is to actually limit the total dose or the amounts that an individual is consuming with these higher concentrated products. So just a final reminder on some of these key points about dose and concentration. First, concentration is the proper way to describe the difference in THC products, not potency. But just know most individuals will probably continue to use the term potency. The dose, the total dose, which is the actual amount of the compound being consumed, the actual amount of THC being consumed, is what matters most, not the concentration. The dose is really what we care about when we talk about benefits and risks. And while consuming a higher concentration product doesn't automatically mean one's consuming a higher dose, using that higher concentration product makes it easier and potentially more likely to take in a higher amount or a higher dose. So if you're not clear on any of these points, please reach out to me. I want to be able to clarify better because this is really important as we think about this topic. And again, especially as we move into thinking about how we regulate and educate on these types of products. So now that we're all on the same page about terminology, let's start talking about what we actually know about these types of products, these high concentration products, and what potential public health implications there might be. So one thing we know for sure is that availability and consumption of these higher concentration products is increasing. Just for example, of cannabis confiscated by the DEA, the THC concentration has risen on average from about 5% THC in 1990 to about 15% THC in 2019. In Colorado, cannabis flower now averages around 20% THC, which is pretty stable over the last few years, but definitely increased since 2010 when medical dispensaries kind of came online. We also know concentrates in Colorado have increased on average from about 56% THC to now about 70% THC. And we also know the availability of these concentrate products has grown steadily in Colorado dispensaries. And the patterns we see in Colorado are pretty consistent with other areas in the United States and even around the world. So yes, the availability of these products is definitely increasing. Now, there's one thing I want to make clear, however. Higher concentration products are not this brand new phenomena. It's not like it's the first time humans have used or consumed these products. For example, hash, which commonly contains between 30 and 60% THC, became common in the Middle East and Northern Africa sometime during the 12th and 14th centuries. And it was really the main form of cannabis consumption in those areas for hundreds of years. There's also a brief period in the 70s in the United States, especially out of California, where high concentration cannabis oil was being distributed and was being used pretty regularly during that time. And finally, even though you'll hear all these terms like this isn't your grandfather's weed and things like that, there are many, many longtime cannabis consumers that say the high quality cannabis they consumed in the 1960s and 70s really packed a similar punch to chemovars today that are more than 20% THC. So while things are definitely changing, let's kind of not allow this narrative to exist that pretends like these high concentration products are brand new to humans and humans have never consumed these before. We also know that higher concentration products, such as loose concentrates and vape pens, have grown in their percentage of sales since legalization. Now, sales of loose concentrates have generally stabilized, though sales of vape pens continue to increase in Colorado. And again, these patterns are pretty similar in other areas. And together, these products now account for more than a third of cannabis sales. We also know that in Colorado, that younger consumers, younger meaning high school students, report their dabbing and vaporizing more frequently with time, with really around 25% reported using those methods of consumption in 2015, increasing to around 45% of high school students now reporting using dabbing or vaporizing in 2021. It's almost doubling. Okay, so a significant increase in younger consumers using these products. We also see similar patterns in young adults, age 18 to 25. So again, adults, but this younger population of adults also increasing their use of concentrates and these higher concentration products. Now, older adults don't seem to be following this trend where rates are relatively stable on dabbing and vaporizing products over the last several years. In addition to being younger, a review out of Washington suggested that concentrate consumers, which they defined by those who dab, this study showed that concentrate consumers had a variety of other risk factors that are already associated with worse health outcomes. This included things like having less formal education, lower household income, lack of health insurance, and underlying mental health conditions. In Colorado, concentrate consumption is highest among those identifying as LGBTQ+, and discrimination against that community already puts them at higher risk of negative outcomes. So one real important signal in all this demographic data we have is that our potentially most vulnerable communities are the ones that seem to be consuming higher THC concentration products. So even though we want to avoid going down this kind of reefer madness, fear propaganda path, there are absolutely good reasons why we have to pay attention to this issue. There's a variety of studies that show those who consume higher THC concentration products will have higher rates of a whole range of things we absolutely want to avoid. We saw last week when we discussed stories of some of these worst case scenarios that there was a common theme. That theme was that these individuals were often consuming products with high concentration of THC. Now, when we went through these stories, you all immediately asked the right questions. What else was going on in the lives of these individuals whose stories we discussed? Was the consumption of high concentration cannabis the cause of their issues? Or was maybe the consumption an attempt to relieve symptoms they were already present? Or did their consumption become out of control because they lacked the support and the structure necessary? So far, no study to date shows a definitive causal relationship between consuming high concentration THC products and these negative outcomes we really want to avoid. Now, we've discussed repeatedly that we can't get too reductionist when looking at cannabis and its potential public health effects. It's always much more complicated than whether one consumes cannabis in general or high concentration products specifically. There are so many other factors involved. Now, some of these are external to cannabis, and they include the various social determinants of health that really contribute the most to negative health outcomes. And if we ignore those factors and only focus on the cannabis, we're totally missing the boat. I just mentioned in the last slide that high concentration consumers already tend to be part of the most vulnerable and most marginalized groups. Those factors undoubtedly play a role in developing these severe outcomes. Plus, there are specific factors to cannabis that might limit or prevent a direct causal relationship between consuming high concentration products and having these more severe outcomes. I stress that just because someone's consuming higher concentration products, that doesn't always mean they're consuming higher doses or total amounts of THC. And as best we know, it's the high doses that are contributing to the negative health outcomes. There are studies that suggest adult, regular consumers of concentrates have the ability to self-regulate their dose. A study out of Washington State found concentrate consumers take significantly fewer puffs than flower consumers, and they report similar levels of intoxication. Another study out of Colorado that tested individuals right after they'd consumed their preferred method of cannabis showed that those who inhaled concentrates had similar levels of impairment and intoxication than those consuming flower. Now, of course, these two studies I just mentioned are in experienced adults that consume cannabis multiple times a week. And we can't assume that all consumers, especially younger, more inexperienced ones, will show the same self-regulation ability. Interestingly, there's a study out of the United Kingdom that showed in a cohort of adolescents, consumption of high concentration products were associated with a whole range of negative health outcomes, such as cannabis use disorder, psychosis, and other mental health issues. Again, this was a correlation. It just showed in these high concentration consumers, there was a higher incidence of these health outcomes. When these researchers kind of did a deeper analysis, they showed it was actually how frequently one consumed these products was really the primary risk factor rather than just the use of the products themselves. Thus, these studies suggest that those who can control their frequency and total dose may still be able to consume these higher concentration products without as many problems. Again, the data is still developing on this, hence why we need more research. So this is a lot to think about, and as with most things in this course, there really are no definitive answers. So what are some take-home points that I really want you to know? First, it's clear that access to and availability of higher THC concentration products has absolutely increased with legalization. Now, this is not automatically a bad thing. There are positives to these types of products. Some patients report better symptom relief when using high concentration products. Some use these products to reduce their costs. Some use them simply to minimize the smell or the stigma of consuming cannabis. But still, we absolutely still need to acknowledge that these products are more prevalent today. Next, there are multiple studies showing a correlation between consuming high THC concentration products and a wide range of severe health outcomes. Again, these are just correlations. It doesn't prove these products cause the outcomes. There are so many factors that contribute. However, we can't absolutely ignore these associations either. Otherwise, we risk having these potentially severe health outcomes become more common and really impact our families and our communities. The research suggests the total dose and frequency of consumption is more important than the actual concentration of the product being consumed. Remember what I've been saying about risks from the get-go. Too much, too often. These are the likely aspects of cannabis consumption that are most important. And especially when you combine too much and too often with consuming at too early of an age, that tends to be where we see the most severe outcomes. Now, it's quite possible that those who use higher concentration products but are able to self-regulate their total dose and frequency may not be at high risk of complications. You also have to remember that with higher concentration products, it's easier to consume too much. So, having good self-regulation skills, having clear intention when you choose to consume cannabis, and having someone to help you monitor your intake is crucial to minimizing risks. And these are specific areas we can highlight with education rather than just trying to demonize a certain class of cannabis products. Finally, our most vulnerable populations seem to be gravitating towards these higher concentration products. This includes adolescents, members of the LGBTQ community, and those who already have impaired social determinants of health. These populations are already at much higher risk for these severe health outcomes. And also, they commonly have less social support and access to good education. Thus, it's imperative we prioritize our focus on supporting these groups rather than just restricting high concentration products and thinking we've solved the problem. So, what can we do? What do I think makes sense? I've already alluded to some of my recommendations as I've gone through this talk. But first, don't be a reductionist. I have said it repeatedly. If you just blame cannabis or certain types of cannabis, you're totally missing the boat. If there is a single take-home point for this whole course, it's don't be a reductionist when it comes to cannabis and public health. Furthermore, we've already tried prohibition and showed it failed miserably. Banning these products will not solve the problems. In fact, it might worsen them. You just have to go back to the Valley vape crisis of 2019, where these illegal adulterated vape pens killed 70 young people. This would never have happened if there was widespread legalization. Plus, banning products typically removes formal education about them, and education is the cornerstone of better safety, in my opinion. Additionally, it typically just backfires if you try to scare people by solely blaming these products for the negative outcomes. The most severe issues we're talking about generally aren't that common. So everyone knows individuals that use high concentration products but don't have problems. So you lose credibility when you fearmonger and exaggerate, and then your important education messages just get lost or ignored. So rather than blame a specific product or groups of products, rather educate about dose and frequency. Those at higher risk for poor outcomes are likely to be harmed by frequent high-dose consumption. Stopping high concentration products for those individuals may be unwanted or unrealistic at this stage in their lives. So you need to meet them where they're at. Start by educating them about how to minimize their dose and frequency, since those are the most important factors in the first place. This is especially important for those in the most vulnerable populations that I've mentioned. Find ways to decrease demand for these high concentration products amongst these populations. There's different ways to do that. Maybe it's more balanced and accurate educational campaigns that prioritize harm reduction rather than prohibition. Maybe it's working with industry to reduce the visibility and marketing of some of these types of products. It certainly involves educating teachers, healthcare workers, and parents with accurate cannabis education and not fear-based propaganda. And of course, let's actually work to help these vulnerable populations to make them less vulnerable to start with. If we prioritize improving the social determinants of health rather than just focusing on cannabis consumption, we will have far more profound impacts. And finally, we absolutely need to continue research. But let's not do research the way we've been mostly doing it for the past 50 years. Let's not just spend all our time and money on trying to prove these products are evil. Rather, let's see research on what educational campaigns tend to be most effective to reduce the amount of THC people are consuming. Let's see research on tools to help consumers self-regulate their own dose and frequency, since we know that's really what's important. Let's see research that compares harm reduction policies to prohibitionist policies so legislators can actually make good decisions based on research. This is the kind of research that I think is necessary if we actually want to reduce the occurrence of these negative outcomes. So thank you for hanging in with me on this one, and I'll see you guys all soon.